Dr. M.A is once again with you. Today we are going to discuss that how we will manage perioperative optimization or management of the high risk surgical patient. Not all the patients who are going to undergo a surgery are at risk. Not all patients are at risk. There is specific population which is at risk. There is specific population which is at risk. We will define that which population is at risk. Most of the time at risk. Most of the time at risk people are elderly people. Elderly people. So the high risk surgical patients are mostly elderly patients, and these patients need special care. So this section is related to the special strategies related to the management of the high risk surgical patient. So mostly these are elderly patients. Why elderly patients are at risk? Why elderly patients are at risk? This is the question. The answer to this question lies that there are several factors which predisposes this elderly patient to various complications and even death after surgery or during surgery. So there are two main factors. The first factor is related to the patient, and the second factor is related to the surgery. So we will discuss that what are the factors which are related to the patient, what are the factors which are related to the surgery. So let's begin that what are the factors related to the patient factors. Okay, the number one patient factor is the age of the patient. At this age there are many comorbidities, there are many other diseases at this stage, like ischemic heart disease, diabetes mellitus, respiratory problems, and other systemic illnesses. So at this stage there are many other problems. So age, comorbid diseases like ischemic heart disease, diabetes mellitus, respiratory disease, and other is they have poor exercise tolerance. They have poor nutritional status. So these are the factors: age, other diseases, exercise tolerance, nutritional status. These are related to the patient. The factors which are related to the surgery are: the first factor is that these patients require often emergency surgery. There is concept, but there are more chances that these patients undergo emergency surgery. So there is less time to have proper planning. So emergency surgery, and these people have rarely minor surgeries. They undergo often major and complex surgeries. So the major and complex surgeries have more complications. The third factor in the surgical factors is they undergo blood loss. They have large blood loss, and also fluid loss is very much in these patients. And also in dehydration is another factor which is related to surgery. Pain is another factor which is related to the surgery, and hypothermia is very important, which we have discussed in some last sections. So these are some factors which are related to the surgery: blood loss, prolonged surgeries, and yes, one factor is prolonged surgery. As the surgery is major, so it will take time. So prolonged surgeries, large amount of fluid loss and blood loss. So these are the factors which are related to surgery. So these patients are at-risk patient, and now we will further discuss in the next section that how we will identify the high-risk patient. Thank you very much.